everyone, and welcome to yet again another exciting podcast episode of How Sweet the Fruit. This official podcast is the podcast of Jamaica Civil Service Association, and of course, I'm your host, Alan Carter. September is Prostate Cancer Awareness Month, and today we're shining the spotlight on an issue that affects many families in Jamaica. Prostate cancer is the most commonly diagnosed cancer among Jamaican men, and raising the level of awareness is critical to saving lives. With us today is our special guest, Dr. Tamu Davison, who is the Director of Non-Communicable Diseases and Injury Prevention Unit at the Ministry of Health and Wellness. Welcome, Dr. Davison, and thank you for joining us.
Thank you. It's certainly a pleasure to be here on this very important topic that affects every Jamaican, and not only just in Jamaica, around the world.
All right. So, Dr. Davison, we're going to be having a very interesting discussion surrounding this topic. And my first question to you, of course, will be why do we need to have a focus on prostate cancer in Jamaica? Why is it so important?
So, prostate cancer, and just so we're all on the same page, is essentially cancer of the prostate gland, which is only found in men. And that is when the cancer cells grow uncontrollably and they can spread to the different organs. So you'll find the prostate, they call it in like a walnut shape below the bladder in front of the rectum, if you can visualize that. But what is most important, it affects men, and it is the most common cancer among men. Not only it's common, but it's a high numbers of men dying from this condition. It's one of the top 10 leading causes of death, including cancer for men in general and including cancer overall. So we're looking at an annual number of men that in fact get this type of cancer. We're looking at about over 1,500 men in fact getting this type of cancer in Jamaica annually, and over 800 men actually dying from this cancer.
Wow, I'm straightening my tie.
And so it impacts everyone. So we're talking about our fathers, we're talking about our grandfathers, talking about brothers, we're talking about our friends. And I'm sure everyone in Jamaica knows someone that has had prostate cancer. But the most important thing, why we're talking about it, is that we know we can do something about it. And most importantly, is through screening, early detection, testing, that we can identify prostate cancer early, so we can intervene early, and so that we can get men into treatment early in order to save lives.
Thank you. And I have another question for you. Currently, there are some misconceptions about prostate cancer. Can you clear up a few of those based on your experience?
Well, there are many misconceptions, but I think the main thing is people see this, and many men, their partners, their families may see this as a death sentence. I'm going to get prostate cancer anyway. And that
So
to
it's
some
not a death
extent,
sentence?
no, doesn't have to be a death sentence
Wow.
at all, because we know there's effective treatment, and we know there are tests, screening tests that can be done to identify the disease early. And another major thing is that people feel, okay, I am feeling fine, I have no symptoms, I don't need to go and get checked, I'm okay. And what we know about prostate cancer and many other cancers, that you have the cancer for many years, for quite a while before you actually develop symptoms.
Wow.
So most people will not have any symptoms. When you start having symptoms, that's usually later on down in the process and the development of the cancer. So this is why one of the things that Ministry of Health has been promoting is what we call the life course approach. So both men, women at different ages getting your routine health check. As a physician, as a someone who has had a relative who has had prostate cancer, that relative is doing very well today because they were getting their routine health checks. So we encourage annual health checks. And part of that health check would be also identifying your risk for prostate cancer and looking to see whether you're at the age where you need to screen.
And that's a very important question I had for you, doctor. What is the age you would recommend for men to get tested?
So typically, for men to be tested for prostate cancer, we recommend you start screening at age 40. However, you do need to look at your risk, and that's something, a conversation you will have with your doctor. Am I at average risk or high risk? So you may, if you're in a high risk group, having close family members like a father, brother who had prostate cancer before the age of 65, any genetic predisposition as well, and of course your age. Certainly, if you're 50 and over, you're going to be at higher risk. And so we in Jamaica start at 40. And the reason is because predominantly we know one of the major risk factors is persons of African descent. And so the majority of our population is of African descent.
Indeed.
And so we start earlier than elsewhere, at the age of 40, recommending that you start screening at that stage. So it is an important conversation you have even before 40 with your doctor, so that you know if I'm at high risk, I may need to do testing earlier. And the two tests that we do is the blood test, which is the PSA, and I use the acronym prostate specific antigen. It's a simple blood test that we do, and then you test to look at the numbers and to see where the numbers are and whether you need to go on to additional screening and diagnostic tests, or you need to be referred. And then we do the digital rectal exam. That's the one that the men just don't, like, but that is also done as well. So what we have been doing is recommending doing the blood test. After you do the blood test, you compare, follow up to do the digital rectal exam. Because even if the blood test is negative or normal, within the normal range, the digital rectal exam is still important, because sometimes you do have cases where persons have normal PSAs and then an abnormal digital rectal exam. And so, in fact, one of our commercials that we have on TV, or testimonials, is from a gentleman who has been doing his assessment regularly each year, and it was normal, and he did his digital rectal exam, which was abnormal, and he went on to be diagnosed with prostate cancer, but early in the game, so that he could intervene, the health team could intervene and give timely treatment.
I have a follow-up question for you, and you're correct. Most men will have an issue with that aspect of the screening. Of course, it is important, and we are encouraging persons to do it. But is there any technology that you know of coming that will take out the necessity for that kind of screening?
Well, not accessible to the routine person. We're talking about thousands of men to be screened within the target age group. And one of the things we are advocating for is men. We know in our setting that men are not coming to our health facility for routine care. And so we have been working to target men and have special clinics for men. But it's important that men, begin to look at their health in general and get these routine health checks from year to year. So for the prostate exam, so if you're doing a PSA or the DRE, we are recommending, if you're, between the ages of 40 up to 54, you would be screened every 2 years, depending on what your results are. And then 55 and over, it's every year. up to about 74. And then thereafter, then the conversation will be looking at what your history is. But most importantly, to have your family, a family physician, a general practitioner who you trust, who knows you. So when they're evaluating you from year to year, they easily pick up if there's a problem from the results that you have. So we're encouraging men to do that. And in fact, we have gone a step further. It's through the National Health Fund is that we're subsidizing the testing for the
Wow.
PSA.
Wow.
We are giving $1,600 if you're in the
And that is
private
additional
setting,
resources to help.
help
There you go.
offset the cost of the test.
Nice, nice. This is good
Because
news.
we know that there's very effective treatment, and then you would be referred on to the specialist. We have the specialist there to support the care that's needed right here in Jamaica. We have some of the best experts in the entire world here to manage this. And countries where men are going in early, then prostate cancer is definitely not a death sentence because we have a treatment in place. In addition to the testing, there's also subsidies for treatment on the National Health Fund as well.
Wow.
So we have, prepared this entire package. If you want to come to the public sector, it's not at a cost, right? For a person accessing this service, you just need to go make that appointment. If you're going in the private sector, certainly we're subsidizing the testing as well. So we're making it easy for our men. And certainly for this month, there's a lot of testing, screening, a lot of health talks. And so we know fear is a big thing for men. The fear going to the doctor in general. They don't want to go to the doctor and they want to make it very quick. So one of the things we continue to do is to look at how best can we create a space for men within our health facilities, our men's health clinics, in our health and regional health authorities, in the parishes. They have a couple of men's health clinics, which includes prostate cancer screening. We do our mobile outreach as well for prostate cancer, but includes other tests as well.
Okay. All right. Thank you very much. That's a lot of information, and it's very important that persons understand that with healthcare within Jamaica is changing. And so with that, the additional support is there. So no longer no one can say that they're not getting the help because the help is there. I have 3 more questions for you, Doc, and I do hope that you'll be able to help us with this. You mentioned in your presentation just now that getting a family doctor, but I wanted to get more specific. How do you believe that families, specifically partners, can help these men to overcome the fear and to get to that point of checks?
Okay. Very good point, excellent point. And one of the common techniques is that usually they bring the partner along and say, come on, their significant other, whether it be their wife, girlfriend, whoever it is. A sister says, come on, we're going together to see the doctor, right? They also observe and listen for some common symptoms. So there are some common symptoms where they have difficulty in passing urine, there's trickling, the urine is not as strong and forceful as it comes, when it
and
comes
these are
out.
symptoms you're talking of?
Symptoms that may occur, and they may hear them going to the restroom and hear the passing urine is just a trickle, or when you pass the urine, you shoot and hit that wall, and no, it's just trickling and it stops and trickles and stops. It's burning. There may be other symptoms like passing blood in urine. These symptoms are not unique to prostate cancer, right? In the early stages, there are other prostate diseases that can also mimic the same symptoms, but we really start looking at about prostate health.
Prostate health.
So the most important thing, what we have found works, is the partner carrying that other partner to get their checks, or sometimes through outreach. So we have been having annual outreaches in Montego Bay, for example. We now have up to 300, 400 men who are just coming out to do their test.
Wow, wow,
Yes. Yes.
wow.
Yes. So, men are becoming more aware in Jamaica. And then it's not only just doing the test. So once the test is done and you have the results and then you're referred onto the specialist, that's another step that you need to take to ensure that you get into that specialist office. And then there are other tests that they will do to make the diagnosis of prostate cancer and then move on to treatment. And so we look at it as the screening is moving from just doing the test, getting to diagnose, and getting into treatment. And treatment may be just observing and following up to see if there's any change in the tumor. So to radiotherapy, to surgery, to different types of treatment. And that will be specific to the individual, specific to the type of prostate cancer, the stage at which it is, and that's a conversation. So it's important that you have a conversation with the doctor. And this is why we encourage that everybody has their general practitioner or their family physician. And, whether it's in the public sector, you're coming to the doctor there, or in the private, someone who you trust and you're confident, and you've developed a relationship that you can talk about your care. And that
Interesting.
doctor is basically, you have an orchestra, someone coordinating your care, so they'll move you and refer you based on what is happening to you and give you this holistic approach. So they'll send you on to the specialist urologist for further follow-up. Depending on the results, your results are positive for further follow-up. So this is why it's important, and we can't stress the importance of having regular checkups, knowing your numbers, and having that point. But yes, your friends, especially girlfriends, tend to drag that significant other to the doctor and to be called to the GP or to the family physician.
Indeed, indeed. I'm very interesting. If you had you have an opportunity now to speak to men in the public service specifically, but also men in wider Jamaica. What is that message that you have for them?
So, men, we are here for you. We want you to take control. We want you to be the CEO of your own health. And so, we're recommending you get your test done, go and get your routine checkup. So, if you haven't done one for a while, visit your doctor of choice and ask about your risk of prostate cancer. So if you're 40 and over, you really do need to get screened, and you do need to get your PSA test done, and also your digital rectal examination
That
as a
one too.
follow-up. Yes, that one too. Very quick and easy. And, choose the doctor of your choice, whether it's a male, female doctor, whoever it is that you trust, and get it done. This can save your life, because the prostate cancer, we know people are dying prematurely from this disease before the age of 70. And the impact on your family and even on yourself, because the whole journey of the illness, your journey of treatment is going to be quite different when you diagnose it early or late. And so it takes in your entire family being part of this process. So it's not only impacting the individual, but that family goes through that whole emotional journey and the financial aspect of it, because you can be on the edge, just surviving really well, and then you wipe out your resources through having a late diagnosis or advanced diagnosis of prostate cancer, which really taps into all of your resources.
Indeed.
But this is not a death sentence. So men,
Then
yeah, come on out. Be the CEO, yes, of
okay.
your own health.
Okay, is there and in wrapping up, is there any helpline number? Is there any number that the persons can call to get in touch with the ministry, maybe the Ministry of Health and Wellness, to get additional information
Well, you
on
can
care?
you can call through our usual line, a regular Ministry of Health line, and ask for information
Okay.
around prostate cancer. but also at your local health department and your local health centers, you can also go in for information
Okay.
around prostate cancer. And you can also visit our website, which is ncdip.com. Yeah, www.ncdip.com, where we have a lot of information. We also have a risk calculator where you can go and assess your risk on your own if you're at risk for prostate cancer and other non-communicable diseases like diabetes, heart disease. Today's World Heart Day.
World Heart Day.
As
Wow.
well. And we know many of the risk factors such as obesity, diet high in fat, physical inactivity, all of these contribute to poor health outcomes, including diseases like prostate cancer and other cancers and non-communicable diseases. So we want to also encourage you to promote healthy lifestyle and to incorporate that as part of your day-to-day well-being.
Thank you very much, Dr. Davison, for sitting with us and sharing so much information with us. I can see and feel and hear the passion that you have in you when it comes on to this issue of prostate health care and prostate cancer specifically. So on behalf of of course, the Civil Service Association, would like to thank you for being a part of this, yet again, another exciting episode of How Sweet the Fruit. And at this time, I do believe we have a presentation, but we will do that presentation to you after. I'm going to be closing. Of course, to our listeners, I want to thank you for joining in with us. And you would have heard from Dr. Davison about the number of resources that's there from the Ministry of Health and Wellness for you to participate in. I also would like to use this opportunity to thank the Jamaica Civil Service Association for leading the charge in ensuring that health information is made available to the membership of the association, but not only the members, to Jamaica in general. Of course, I'm your host, Alan Carter, and I hope I would have done an excellent job in terms of hosting this episode. So until next time, see you on How Sweet the Fruit. Take care.